Hello and welcome to yet another episode of Doctor's In. Today we have with us Dr. Prathap Kumar, who have been specialized in shoulder and upper limb surgery. Let us welcome him to the program. Welcome, Doctor.
Thank you.
Could you tell us your experience in the field of shoulder and upper limb surgery?
Yes, shoulder and upper limb surgery is a subspecialization in orthopedic surgery. Recently, in India, it has been developed as a subspecialty. But quite a few years ago, the Western world has developed this specialty. Probably the reason may be due to increasing sports injuries and increasing other sort of shoulder injuries. If you look at the Western world, the orthopedic surgery has got many subspecializations, like trauma surgery is completely different, shoulder and upper limb surgery, hand surgery, spine surgery, pediatric orthopedic surgery, and arthroplasty surgery, which is knee and hip surgery. So this is one of the main subspecialty of orthopedics. My orthopedic surgery back in India, 1989, and after that I went to England and had my fellowship. I started practicing in England in 1995, had my fellowship, general fellowship, and after that I had my shoulder and upper limb surgery fellowship, and I was working as a consultant in one of the university hospitals.
So, what is shoulder keyhole surgery?
Keyhole surgery has been practiced for quite a few years. People are aware of laparoscopy surgery, where the abdomen is opened through a small keyhole. Keyhole in joints is called arthroscopy. For last few decades, knee arthroscopy was very popular, but shoulder arthroscopy is something new. So keyhole surgery for shoulder means we are looking the entire surface of the shoulder joint through a keyhole, through a small opening. Usually we make it in the back side of the shoulder. The good thing is that we can view the entire surface of the joint.
Okay. What are the advantages of doing the surgery?
The main advantage should say is we don't need to open the joint at all. And in conventional surgery, that is open surgery, you'll have to make a big cut to open the entire joint and look through the big incision to see what is the problem. And then we'll have to cut the muscles or tendons and ligaments to reach the problem, and then only you can fix it. So we will be unnecessarily cutting the normal tissue. Here there is no question of cutting the normal tissue. Plus the advantage is that we can magnify the picture. So if there is a small problem, we can magnify it, we can enlarge the picture and see what exactly it is.
Okay. What are the precautions to be taken by the patient before a surgery is done?
Well, for the patients, they don't have to make any precautions. What we generally do is we will prime them what to expect in theatre, what to expect after surgery. So we'll counsel them. Otherwise, the patient won't feel the difference. Well, the patient will feel the difference in the sense that they will have less pain and they will have less discomfort in the immediate post-operative period and in the long run as well.
Okay. What are the advice given to the patients after the surgery?
That depends on exact surgery we are doing. For different surgical procedures, we will be giving different suggestions and precautionary measures. If you are doing for a tendon repair, we will be supporting the arm and the shoulder for a few weeks before we start doing the exercise. So that things will be explained to the patients.
How long will the patients be hospitalized?
That's the most interesting thing. The hospital stay is considerably reduced. For my patients, when I do keyhole surgery for shoulder, the hospitalization is 1 day. There is a logistic problem. I get patients from all over Kerala and from outside as well. So those patients who is traveling from faraway places, they will get admitted on previous day.
Okay.
Usually my norm is the patient will get admitted on the same day morning, will get the surgery done, and by the following day lunchtime they will be discharged back to home.
What is the actual cost for this surgery?
People have a general feeling that the keyhole surgery is very expensive because it's a high-tech surgery. As it is a high-tech surgery, however, we need to look at the long-term benefits and long-term cost of this surgical problem. The conventional surgery, as I said, patient will be in hospital for more days, so the hospital stay and abstinence from their work. I do have a lot of patients from the IT field. Their work means money, so they want to go back to their work as soon as possible. I will let them go in a week's time after major surgery, major keyhole surgery. And few occasions, people have gone back in the second day and third day. So I will give the confidence to them. So if you combine all these things, the expense of the keyhole surgery may be equal or even less than an open surgery. But to be precise on your question, depending on what surgical procedure we do, it will be around 1.25 lakhs rupees per keyhole surgery. Why this is expensive? As I already told you, this is a high-tech surgery. Yes, we do utilize the service of many instruments, very fine instruments, like a controlled pump to pump fluid into the joint during surgery. We use something called radio frequency ablators, which will be less damaging to the inside of the joint. And the conventional one, if you think about that, it was the normal, something called a diathermy, which could be detrimental to the covering of the joint. So we don't use those sort of things. So that is why the cost is high. Plus, to repair any damage, we use something called biodegradable anchors, especially inside the joint. Biodegradable anchors means it degrades by itself after the purpose is served. So it dissolves into the joint. It's just like your wall anchor to fix something onto the wall. We put the anchor into the joint, and then there's a suture material attached to that, which ties onto the tissue to be repaired. And after probably 2 years or so, the anchor will get dissolved into the bone itself. If you look at the conventional one, it's the metallic anchor, which can cause trouble later on. Okay. So all these things will add up to the cost. But long term, the patient will get benefit.
What are the limitations of doing shoulder keyhole surgery?
Limitation in one sentence is a long learning curve for the surgeons. That's the main issue. And probably that is the reason why the keyhole surgery for shoulder wasn't as popular as the knee. Knee is probably most of the hospitals they are doing the knee keyhole surgery because there is more space there and less cumbersome. But if you look at the shoulder joint, there are a lot of ligaments, a lot of tendons, and to add to the agony, the space is very limited. So we are working in a very limited working space. And to learn this, the learning curve for the surgeon is very long compared to any other surgery. But from the patient's point of view, sometimes what we do is we are doing the surgery in a sitting up position, which most of the patients or public doesn't know. We take a position called a B-chair position. So actually, once the anesthesia, the patient is put to sleep, the patient will be sitting actually, and we will be doing surgery in the sitting up position. Well, it can be done on the lying down position onto the side as well, but the most comfortable position and the most anatomical position, the normal position where we can do the repair, is the sitting up position. So there can be some limitation, especially with the older patients. The blood supply to the brain can be reduced, and that can be a problem, even though it is very less common, very rare. But that can be a limitation, in which case we will have to do it on the lying down position onto the side. Otherwise, the cost of the instrumentation, that could be a limitation as well. Otherwise, I don't think there is any limitation from the patient's point of view.
What are the side effects of shoulder keyhole surgery?
Well, I don't say there is any side effects for keyhole surgery, but surgery as such, we need to analyze the complications of a surgery as such for a shoulder joint, and then we will explain what is what. If you look at the complications of surgery for a shoulder, one is infection. That's the most dreadful complications you can expect. Now, if you look at the conventional one, you will be making a big incision, big opening into the joint, and you will be keeping it open for probably 1.5 to 2 hours. Even though we are using special theaters in our hospitals, many of the modern hospitals, theater called a laminar flow theater, where there is a sterile flow, constant sterile flow of air into the field. So that will reduce the infection rate. But even then, in open surgery, we will be keeping the joint open for 1.5 to 2 hours. If you compare it with keyhole surgery, we use a 4 millimeter camera scope to put inside. So that means it's a very small incision, and mostly that is occupied by the camera. So there is no actual communication to the outside. Okay. So obviously the infection is very, very less for keyhole surgery. Plus, we will be washing out the inside of the joint all the time. So even if there is any question of any bacteria coming in, it will be washed out. The other things can be damage to the surface of the joint. But again, if you open up the joint, the chance of damage is more, because you will be retracting the parts of the joints. In keyhole surgery, yes, I do agree, in the initial period of a surgeons who can be inexperienced, they can do some initial damage. Even though it's not major, can cause some damage. But usually, the experienced surgeon will be by the side, so I don't think that will be a big problem. Again, in open surgery, you can damage your nerves and blood vessels. But in keyhole surgery, you will be seeing and then doing the surgery, taking the stitch or cutting the tissues and sort of thing. So you will be seeing whatever you are doing. So you will elaborate what you are doing before you do any sort of a cutting or other procedures. So that's also a sort of a safe one.
So now coming into upper limb surgery,
yes.
Could you explain to a layman what actually it is?
A limb means your legs and hands. Okay, you got two skeletal systems in your body. One is your axial skeleton, which is the center part of your body and your spine, your backbones. And the other side is called the appendicular skeleton, which is the limbs. You got 4 limbs, 2 upper limbs on the upper side and 2 lower limbs, which consist of your hip, knee and ankle. In the upper limb, you got your shoulder, your elbow, your wrist and hands. So any problem with that part of the body comes into the upper limb surgery. But the major problem usually occurs is in shoulder. That's why the shoulder gets the prominence, and the specialty is called shoulder and upper limb surgery.
How the surgery is done? We
do the surgery, keyhole surgery, in a sitting up position, as I explained already. And we use general anesthesia. General anesthesia means patient will be sleeping throughout the procedure. You don't have to worry about now putting the patient to sleep nowadays, because we got all the equipments to monitor each and every parameters of the patients, like your blood pressure, your oxygen level, your carbon dioxide level. Everything will be monitored then and there on a monitor. So that part is safe. After the patient is set up in the sitting up position, we drape them. Okay, or isolate that particular area from the other areas, and we use something called disposable drapes. Conventional drapes were clothes, Nowadays, we don't use the cloth material, which could be wettable. Okay. Now, we use a paper-like material, which can be water impermeable. That's again a part of infection control. And we use that material for the drape. And once that is done, we are all set to go for surgery. Before that, our team will set up the camera, the water pumping system, as I already told you, and all other instruments which is needed for the surgery. The other instruments we commonly use are drills, bone drills. We use drill bits and drills to put the anchors into the bone. So all these things are prepared by the team. The first cut for a keyhole surgery for the shoulder is on the back side of the shoulder joint, and that is roughly 4 millimeter cut. And from the back side, we introduced the instrument, the mainstay of the surgery, which is called arthroscope, which is connected to a camera. So arthroscope actually is a metallic sheath, which is roughly 4 millimeter diameter. So that will exactly go through our opening. And once we go inside, we can see the inside of the shoulder, right from the front, back, and to the side. And the assistant will rotate the shoulder so that we can see the entire surface of the shoulder joint. Plus, I can use the camera. I can rotate the light source of the camera and the camera itself, so that I can go wherever I want to see whether there is any lesion. Something called hidden lesions probably is not seen on the X-rays or MRIs or CT scan. We look for those are called hidden problems. So we can look into the hidden problems as well. Plus, the advantage is that, as I already told you, we can enlarge the picture. So if you are suspicious about a small lesion somewhere, we can always enlarge it or change the contrast and see what exactly it is. And we don't have to open it at all. People usually ask, can you do any surgery through the keyhole? Answer is yes, except replacing the joint. If you want to put an artificial joint, you will have to open the joint and then put the artificial joint. Otherwise, we can do all the surgeries which through the keyhole, which can be done through open surgery with positive advantages.